Hi, it's Doug Holland, LMT, with a massage tip for massage professionals. Today we're going to be discussing thoracic outlet syndrome. And as we know, a patient comes in and they have already seen their doctor and they describe a sensation that comes down their neck, through their shoulder, and down their arm to their hand. It can be a feeling of electrical shock. It can be a burning sensation. It can be numbness. It can be also weakness in that arm. They might have a hard time abducting the arm or even flexing the arm. So we're going to discuss where this problem comes from, which muscles need to be addressed, how I like to address these particular muscles, and we're going to draw them on the patient using markers to really help us hone in what we can do. Okay? So let's get down to the table and let's get started. Okay, so in order for us to get a good idea on how to address thoracic outlet syndrome, what we want to do is we want to first figure out on the patient's neck where the cervical transverse processes are. So what I do is I simply palpate. We know that it's a little posterior to the sternocleidomastoid, and I'm just going to go ahead and draw some of those cervical transverse processes for us to get an idea where we're at. We know they go deeper than that. And then what we're going to locate from there is we're going to locate the two scalene muscles that are part of this problem. One is the anterior scalene, and we know it goes to and underneath the clavicle. And we know the middle scalene goes to and underneath the clavicle. And we're going to explain why they go underneath. They go underneath because they have to attach to the first rib. So what we want to do is we want to find the manubrium, which is the beginning of the sternum here. So we find the manubrium, and then where it joins the clavicle, we'll draw the clavicle line like this. So this is the clavicle bone, and the scalenes go underneath that to the first rib, which is underneath there. I'm going to use a different marker to show you right here where the coracoid process is, and this is a really extremely important one. And then we need to draw where the subclavian muscle is. We'll do that also. So this is where the subclavius, sub meaning below, so we have the subclavius muscle here. And I'm going to use red to describe where this brachial plexus starts. The brachial plexus is where all those particular nerves and then when the subclavian vein come through. So here's anterior scalene, middle scalene, and this is where the nerves start. They go behind or underneath the clavicle, subclavicle, right? So we're going below the clavicle, and then we're running along underneath the subclavius, which the subclavius is the muscle that joins the clavicle on both ends. And then right here, this is an important part, we're going to go underneath the coracoid process. Let me get another marker here. We're going to go underneath the coracoid process where the pectoralis minor is. So the pectoralis minor, it's a convergent muscle. We're going to just draw that as an example. Now it attaches to ribs 1, 2, and 3 there. All right. So we're back to the artery and the plexus itself. We go underneath and right through here and in through the shoulder and then down the arm we go. Now why do we want to draw that like that? Because there's two areas of concern. We're either going to find right here where the two scalenes come together, we're going to find inflammation, tension, and stress there. So we're going to draw an X there. That's going to be one of the problems. Or I find, most of the time, it's right here as it goes underneath the pectoralis minor on the middle part of that coracoid process right there. This is a huge target area for me. All right. Now by drawing that, I hope that illustration helps, because we have these 2 points here that are going to become usually our biggest problem. I will work the subclavius muscle too to bring some relaxation to that area, but my big thing is when I demonstrate how to do this, I want my thumb to be just inferior to the coracoid process and work my way down through this pectoralis minor to take tension off that. Now, why do I want to take tension off the pectoralis minor? Because as we know, it's a protractor. It's a punching muscle, right? It protracts the scapula or brings it around like this. It brings around. It's a synergist to the serratus anterior, right? Which also is a protractor. So they bring the shoulder around, and if they're in flexion, if this one's in flexion all the time, because of our modern way of life, our shoulders being slumped over, it puts pressure on the brachial plexus. It pinches the nerves and the arteries that pass underneath here. Same thing with the scalenes. If the neck is real tight, if the traps are tight and the neck is real tight, if the scalenes in this area, it will pinch the nerves in here, which if you pinch the nerves, then we get these crazy sensations that go down the arm. So we're going to focus on scalenes, and we're going to focus on the pectoralis minor where it inserts there to bring relief to the brachial plexus. Okay, so now we're going to demonstrate how to do the scalenes first before we do the pectoralis minor. Remember, there's that beautiful sweet target spot right in here where the anterior middle scalene comes down. What I like to do is just use a little bit of lotion on my hand like that, and I take the back of my knuckles, and I work my way up towards the occiput. So I'm dragging my knuckles through like this and forcing them to stretch all the way up. Now that's how I'm going to warm up the muscles, by doing this. I start at the shoulder, right at the deltoid, and then I work my way up all the way through the trap a little bit, and then I go until I hit those scalenes real well. And I'll even do the sternocleidomastoid while I'm here. You might as well go ahead and hit the sternocleidomastoid. But you can feel them. They'll be real tight all the way up and through here. You'll feel those scalenes will be real tight. Now you can also use cross fiber friction. So I'll take my knuckles and I'll go back and forth like a guitar, and I'll strum with my knuckles all the way through real gently and keep working my way until I get more and more permission by the muscles to get deeper in there. So I'm either going to do a sweeping motion like this and drawing up to the occiput, okay, like that, or even to the mastoid process of the temporal bone, or I'm going to use cross fiber friction. Now, if the person is laying supine, I also can do circular friction right on those transverse processes, right where those scalenes come in contact. I can actually work them and find out where there's tension and stress in those muscles, see if they're hypertonic as I go through there, just like that. And I can feel a little bit of tension on these guys as I go through there. If you feel a pulse as you're going through, just get off of it. That's why I prefer the sweeping and cross fiber, because you're never going to be pressing with any length of time to get in there. But that's how you're going to handle that particular little area that we will find compression on the brachial plexus. Now we're going to move over to where the pectoralis minor inserts under the coracoid process. So now we're going to address where the pectoralis minor inserts. Remember, we simply follow the clavicle all the way over until we feel the anterior part of the scapula, which is right in here. And then we palpate around until we find that coracoid process of the pectoralis minor, which is right there. Okay, so I got my thumb, I'm pinning it down. This is right where the brachial plexus goes up underneath. Okay. Now, how I address it is once I pin it down and I'm on the muscle, I'm not on the coracoid itself, I'm slightly inferior like this on the muscle. I can feel the banding of it. I take the arm and I rotate it in circles like this to cause the stretch. All the way up, all the way back, and all the way down. And then I'll move a little bit further onto the muscle, and I'll do the exact same thing. And I'll pin it again, and I'll move it around. You can tell if you're on it because the pectoralis major doesn't move like that. The pectoralis major, it inserts in the intertubercular sulcus of the humerus. It's going to be more superficial of a muscle. It's going to come across here. You can actually feel, though, when you're on that pec minor and that coracoid process right there. And I just keep following it down. Yeah, there it is. And I get that to release. I get that to release. Now, I'm not going to joke about this one. This can be very, very painful for most people when you work in it. Now, I'm trying to work backwards because of the camera, but I like to hook my arm up underneath here. Find that clavicle, find the coracoid process, pin it, and then rotation. And you can take the arm and actually, if they have a healthy elbow, you can kind of crank the arm and pull and just do a little bit of cross fiber friction on. I am right on that baby. You're taking a muscle that's probably constantly in flexion, is short, and you're asking it to loosen up. And when you do that, it allows the shoulder to extend and go back. Now, another way I'll do it is I'll take the palm of my hand and I'll pin it like this, and then I'll do circular friction this way. Okay? I am rocking back and forth, and this also can be painful, but every time you change the position of the arm, it's the same thing. Every time you change the position, you're working it a little bit differently as you go in there. Okay? And that's basically how I address that. I'm either going to be deep compression with my thumb, or I'm going to use my palm of my hand to get in there and press down and work it. So scalenes and this particular triangle, you work those two areas right there, you're going to bring tremendous relief to people with brachial plexus issues, thoracic outlet syndrome symptoms. Well, I hope you enjoyed this tip on thoracic outlet syndrome. If you enjoy my videos, please hit like and subscribe. And just remember, if there's never any discomfort with the patient while you're working on them, well, it's probably nothing more than a foo-foo massage.